So, you've got a cavity, and even the slightest little thing sets your tooth off, causing this intense, sharp pain. But where exactly is the nerve that's carrying all that pain? A lot of people are curious about that. So today, we're going to use this model to help you understand the structure of a tooth and what's inside it. This right here is a model of a human tooth. The outermost layer you can see, this is the gum. And this area here is the alveolar bone, the bone that holds the tooth root in place. First, let's look at the outside shape of the tooth. Based on its location, we can divide it into three parts. The first part is the one we're all pretty familiar with, the part of the tooth that's visible above the gum. That structure is called the crown. Now, this crown here is a teaching model from a dental school. Right below the crown, you can see there's another section. The tooth is actually quite big. There's this lower part. That's embedded in the alveolar bone and the gum. This part here is what we commonly call the root. Now, with these two parts, the area where the crown and the root meet, that's what we call the neck. So, looking at the external shape, it's roughly divided into three sections: the crown, the root, and the neck. Now, if we look at it from this cross-section view, it's like we've cut away a part of the tooth. After doing that, we can take a closer look. So, what exactly makes up a tooth? Let's start with the first part. The very outermost part of the whole tooth, this outer layer, specifically here on the crown, this area I've highlighted in green, is called enamel. We're all pretty familiar with this. Enamel is the hardest substance in the human body. Its hardness is related to its level of mineralization. The higher the degree of mineralization, the harder it is. In adults, the mineralization of enamel is higher than in children. But along with that, it creates one issue. What's that? Well, the higher the mineralization, the more transparent the enamel becomes. What does that mean? Let's take a look. Right underneath the enamel, there's this next layer. That's called dentin. Dentin is yellowish. We'll go into more detail in a bit, but because the enamel is transparent, you can see the yellowish dentin underneath. That's why the tooth appears a bit yellow. So, you'll notice in adults, if their enamel is highly mineralized, their teeth tend to look slightly yellow. But this yellowish tint, it's not because the tooth surface is dirty. It's actually because the enamel has become translucent from mineralization. Once it's translucent, you see the dentin inside, and that's when we notice that kids' teeth are usually much whiter. Why is that? Because the mineralization is lower, so the enamel stays this milky white color. Just take a look at the kids in your family. Aren't their teeth really white? Totally different from us adults. So that's the enamel. It covers the surface of the crown and acts as a protector for it. Now, underneath the enamel, you can see there's another layer. Let me highlight it for you. This is the layer covering the root surface, this green structure right here, it's called cementum. Cementum isn't as hard or as tough as enamel. Let's think of it this way. Imagine the whole tooth is like a nut. The dentin, this area right here, the dentin is like the meat inside. And these two outer structures, the enamel is like the hard outer shell of the nut. And then the cementum, it's like a protective layer coating that shell. So, it makes sense, the hard shell is definitely tougher than that protective coating. The enamel does a better job protecting the dentin than the cementum does. Definitely more than that protective film. Better protection. Alright, moving on, let's look at this middle layer. This central section. This is the dentin we were just talking about, and it makes up the main body of the tooth. Think of it as the meat of the nut. It's yellow. So, like I mentioned earlier, if the enamel has a high degree of mineralization, it becomes really transparent, allowing you to see the color of the dentin underneath. That's why adult teeth tend to have that slightly yellowish hue. Now, let's check out what's inside here. You can see this area right here. This is the pulp cavity. This is what we call the pulp cavity. If we open it up, and then down here, the part of the pulp cavity within the crown is called the pulp chamber. And this part inside the root, that part of the pulp cavity is called the root canal. You've probably heard the term root canal treatment. That's exactly what this is about. Let's take a closer look inside this pulp cavity. What's in there? I'm going to hide this part of the root canal. Once I hide it, we can see what's actually inside. There are nerves, and there are blood vessels. So, the pulp cavity is essentially filled with nerves and blood vessels. Now, where do these nerves and blood vessels come from? From this spot. You can see, at the very bottom of the root, there's a tiny opening. See, there's a small hole right here. This tiny opening is called the apex. Blood vessels and nerves enter the pulp cavity through this opening. So, what happens when you have a cavity? Let's think about it. When there's tooth decay, what does that mean? It means the enamel gets destroyed. And once that's damaged, the dentin gets damaged too. This creates a pathway. It forms a channel. Now, from the outside, things can get into the pulp cavity. I'll use green to show this. It can get into the pulp cavity. Essentially, these irritating substances can go straight into the pulp cavity and the root canal. Bacteria can also get in. These things can directly stimulate the nerve. Just imagine, if the nerve is directly exposed to the outside, it's going to get a whole lot of stimulation. So, it hurts. It hurts a lot. That's why, when you have a cavity, even the slightest little thing sets it off, while your other teeth feel fine, but that one tooth with the cavity is just incredibly painful. It's because the nerve is exposed and connecting with the outside world. Now, if inside the pulp cavity, some people might have had pulpitis, if there's repeated inflammation inside the pulp cavity, the nerve there will also be extremely painful. So, what's responsible for carrying that pain signal? It's this nerve. The nerve gradually transmits the signal upward, passing through here and continuing on to the nerve center. The nerve that carries tooth pain is called the trigeminal nerve. It sends the signal to the nerve center. That's the nerve pathway for tooth pain. Now, let's take a look at what structures hold the tooth in place. Look at this area. Earlier, I mentioned this structure. This is the cementum. And this is the alveolar bone. Let me highlight them both. See, here's the alveolar bone, and this is the cementum. You'll notice that the cementum and the alveolar bone aren't actually in direct contact. Between them, there's this other structure. This white structure right here. The area I'm circling here. That's called the periodontal ligament. Periodontal ligament. These are fibrous connective tissues. They help hold our teeth in place, and when we chew, think of this as a membrane, a fibrous connective tissue. It acts as a cushion. When we bite down hard, this membrane, it helps absorb the shock. So this is what we commonly call the periodontal ligament. And when we talk about periodontitis, that's essentially referring to an issue with this ligament. If there's a problem with this ligament, the inflammation can gradually affect the gums. The gums can recede. It can affect the alveolar bone. The alveolar bone can start to shrink. As it shrinks, what becomes exposed? As it recedes, the cementum gets exposed. Once it's exposed, the tooth becomes much more vulnerable to external irritants. So, That's the structure of our teeth and the nerves inside. If there's anything else you're curious about, feel free to leave me a comment. Thanks for watching.